Hello everyone, I'm Dr. Swagatesh Bastia, Director and Co-founder at Alleviate Pain Management in Bangalore. Today we are going to discuss L4-L5 disc bulge or disc herniation. Now to understand this, we have to know the fact that low back pain is a prevalent cause of disability worldwide and it causes a major drain on the health resources all over. So what is L4-L5 disc bulge or disc herniation? With the help of this model, we can understand this. This is a model of the spine showing the different bones. These are the vertebrae. In between these bones are shock absorbers, the natural shock absorbers, which are known as discs. Now, as you can see at this level, which is the L4-L5 level, this red protrusion out, this is exactly your disc herniation. Now what happens is, as we age, the elasticity of the disc decreases and gel-like nucleus pulposus, which is bounded by a membrane known as annulus fibrosus, it tends to seek out or advance out of this bounded membrane. So there are cracks in this membrane due to which the nucleus pulposus advances and causes the symptoms. Most important one being age-related mechanical wear and tear of the disc vertebra complex. This happens as the disc lose their elasticity with age and become more predisposed to breaks and herniations. Next is poor ergonomics. Poor posture at workplace, especially at lifting heavy things or bending and twisting activities done in an improper posture can make someone predisposed for lumbar disc herniation. Obesity. Increased overall weight would in turn put more strain on the lumbar segment, leading to disc herniations. Sedentary lifestyle can also contribute greatly to the development of this pathology. Trauma. Sometimes disc herniations might result to significant trauma suffered such as road traffic accidents or sports injuries. Repetitive stress. Now, repetitive stress are seen in certain occupations which involve everyday lifting of heavy things, twisting and bending activities, and occupations such as driving. These can also be a risk factor for development of lumbar disc herniation. Now, every person might suffer with different symptoms, but the main characteristic symptoms of L4-L5 disc bulge or disc herniations include low back pain. This might be continuous or intermittent and is more of axial in nature, that is, it is in the midline, and it is indicative of discogenic back pain. Second is radicular pain or sciatica. This might happen due to the sciatic nerve getting affected because of the disc bulge or the disc herniation, and it can lead to pain associated with tingling and numbness along the distribution of the sciatic nerve. Then there might be muscle weakness. This happens when the nerves governing the motor function of the muscles of the lower limb get affected. You might have muscle weakness in the affected muscle groups. Loss of bowel and bladder function. This might happen when there is a big disc herniation which is actually compressing on the spinal cord. This can lead to loss of control of important bodily functions such as urination and passing stools. This condition is referred to as cauda equina and it calls for an emergency. Careful history and clinical examination can give us a strong clue towards the diagnosis, but the gold standard in the investigation remains MRI, which is magnetic resonance imaging, which tells us exactly location and the extent of the disc herniation. So discussing the treatment, usually a conservative approach is initially taken to handle these situations. The patient is advised rest, activity modification, and they are also given non-steroidal anti-inflammatory drugs to reduce the pain and inflammation. Plus, patients are also advised for physical therapy, which is focused on stretches and exercises to strengthen the lumbar group of muscles. Patients are also given heat packs to reduce the spasm of the back muscles. Now, if these conservative approaches fail, then the next option would be a fluoroscopy-guided transforaminal or interlaminar epidural injection right into the affected area. This is generally a mixture of local anesthetic and steroid, which is given under image guidance. Epidural steroid, along with structured physical therapy, is seen to benefit a lot of patients. At Alleviate, however, we go a step further, and along with epidural injection, after a gap of a few weeks, in case if there is degenerative disc disease, we subject the patient to a comprehensive PRP prolotherapy treatment of the lower back to strengthen the lower back so that they do not further in life face this problem again. Now, cases that are not managed by conservative means and even injections are cases that call for surgery. Now, this constitutes roughly around, say, 10% of the total cases of lumbar disc herniation. The surgical options include open surgery, microdiscectomy, and endoscopic discectomy. Prevention. Now, how do we prevent this nagging problem? This is not so difficult. We can do this with an active lifestyle and regular exercise regime, then maintaining a good diet and maintaining optimum weight, and also practicing good ergonomics at our workplace. If you're suffering from disc bulge or disc herniations, don't wait and don't let the pain aggravate further. You can reach out to any of our centers at Alleviate Pain Clinic, and we will do a thorough evaluation and give you a proper treatment plan for the same.